My name is Ken Hekman. Welcome to this course called 4 Essential Disciplines, a training guide for healthcare leaders worldwide. My colleague, Quinton Friesen, and I are leading you through 15 modules to help you improve your knowledge, skills, and attitudes as a healthcare leader. This is Module 9 of 15. In this module, we will conclude the management discipline by talking about 2 functions together: implementing and monitoring. Let's review our learning objectives. Our goal is that you will discern how policies, procedures, and systems work together to achieve organizational consistency. You will learn about work plans, key performance indicators, and dashboards for monitoring progress. You'll recognize how changing expectations in both external and internal markets feed the need for continuous improvement.
In the last module, we talked about organizational charts and job descriptions as the building blocks for an efficient organizational structure. Likewise, implementing and monitoring functions require policies, procedures, and systems as building blocks for organizational achievements. Let's take a closer look at each of these building blocks. I
once worked as a consultant with a small organization that was big on policies. Although there were fewer than 12 employees, they sent me 2 boxes of policies to review before the consultation. When I got there, I found a notice posted in the break room that said, "Our policy is to follow the policy. If there is no policy, our policy is to create a policy."
Some organizations may take policies too seriously, but policies do play an important role in management. Policies are simply guidelines on how to handle recurring situations or problems that are important to the organization. If managers are required to make a similar decision over and over again, it is probably time to create a policy. But policies should be seen as changeable rather than static. They should be reviewed annually so they can be updated to remain relevant or discarded to avoid wasted resources. Policies can be a management tool to help staff members make their own decisions, particularly for issues that arise frequently and that do not need the attention of senior management each time they arise. Common examples of policies in healthcare organizations are personnel policies, medical staff policies, and infection control policies.
Procedures are step-by-step guides for common activities that need to be done consistently each time. When procedures are spelled out in detail, they can become valuable tools for training new employees and for evaluating the performance of all employees. They can also become excellent tools for maintaining safety and quality of care. Examples include procedures for cleaning healthcare facilities, handling infectious waste, maintaining medical records, reporting medical errors, maintaining medical equipment, and preparing monthly reports.
Systems are groups of activities that relate to major processes. For example, medical equipment may require preventative maintenance systems. Likewise, new employees can benefit from a systematic orientation to the organization and to their job. As you can see, systems might address activities that involve different departments of the organization, but they are all part of the same process.
So how do these building blocks work together? How can policies, procedures, and systems benefit the healthcare organization? They can provide substantial benefits to the management team, but managers should also understand their limitations and their risks. Their benefits include: they provide consistency in managing resources. They contribute to a safe work environment. They ensure that critical equipment continues to function well. And they simplify training for new employees. The limitations and risks are that they can lead to rigidity, especially for issues related to staffing. They require regular updating, and you have to monitor for their compliance. It's impossible to have policies for every potential event. and policies cannot manage an organization without management discernment.
Now let's turn our attention to reports that can help managers monitor organizational performance. We will focus on work plans, key performance indicators, and dashboards.
A work plan identifies the tasks required to successfully accomplish large projects. It breaks down those projects into smaller logical steps. For each task, the manager should identify who is responsible to accomplish the task, what the end result or deliverable will be, and the deadline for achieving the task. Work plans are excellent tools to use with teams made up of people from different disciplines and multiple roles. They can serve to keep everyone accountable for accomplishing their respective roles within complex projects. Work plans can be easy to set up in a Microsoft Excel worksheet or on plain paper. If the work team reviews the work plan regularly, it can become a helpful tool to track progress and to make course corrections to keep the project on track.
Key performance indicators, or KPIs for short, are performance measurements for activities that are critical for success in the organization. Every organization might want to track budget comparisons, employee turnover, and safety records. Healthcare organizations like hospitals will want to track additional key performance indicators like patient volume, average length of stay, occupancy levels, patient satisfaction, and other quality measures. Key performance indicators can be thought of as the vital signs of a healthy organization, in the same way that physicians track vital signs for their patients.
An organizational dashboard is a simple method for tracking key performance indicators. Like the dashboard on a car, this tool can give managers information in a timely manner about the performance of the organization. It can serve as an early warning system for critical activities, allowing managers to intervene promptly when a key performance indicator registers a problem. Managers may also use dashboards to compare against industry benchmarks or against performance measures from the previous year. Dashboards are usually updated monthly, but they should remain highly visible and updated with sufficient frequency to alert managers to changes in performance on critical functions in the organization.
So far in this module, we have talked about management tools for implementing and monitoring the performance of an organization. But expectations about organizational performance, especially for healthcare organizations, are constantly changing. New medical technologies and knowledge advances our ability to diagnose and treat patients better every year. In emerging economies, patients and their families raise their expectations for healthcare, along with their rising incomes. Around the globe, healthcare regulators and consumers are demonstrating an insatiable appetite for continuous improvement from healthcare organizations. Let's take a look at why, how, and when to raise the performance of the healthcare organization.
The motivations for continuous improvement should be obvious. Change is constant, both outside the healthcare organization and within it. Advancements in medical technology in the past few decades have been remarkable, and the emergence of genomics and nanotechnology offer promise of more advancements in the future. The costs and the benefits will need to be weighed carefully, but managers will need to remain alert as they discern if and when to adopt new innovations. New knowledge is also impacting the capabilities and the motivations of healthcare workers. Physicians' assistants and nurses are now doing functions that were formerly reserved only for physicians, and new professional disciplines are emerging at the same pace as new knowledge. Healthcare consumers' expectations are also changing. If consumers can get prompt and courteous service at local restaurants and stores, they grow to expect the same kind of timely and courteous care at their local hospital or clinic. Expectations are constantly changing all around us, and as healthcare managers, we need to improve continuously to meet and exceed those rising expectations.
How can managers set the stage for continuous improvement? We can begin by committing to a regular strategic planning process and setting new goals for the organization. We can also monitor organizational performance by tracking key performance indicators with dashboards. Management teams should always be looking for ways to reduce waste and efficiency and reward innovative ideas that emerge from employees on the front lines in every department. Since consumer expectations often set the stage for future requirements, healthcare managers should consistently invite feedback from the patients and from their families. Patient satisfaction surveys should be a routine practice for every hospital, clinic, and healthcare organization. If healthcare managers ask for ideas for improvement, rather than merely responding to complaints, they are more likely to remain in service and grow in quality.
Each part of a continuous improvement agenda has its own timeline. For example, strategic planning processes should occur at least once per year. Dashboards, however, might be updated monthly to keep key performance indicators highly visible and timely. Managers should review incident reports or safety logs perhaps on a daily basis so they can respond immediately to significant safety concerns. Patient satisfaction surveys should be an ongoing exercise, although managers may review the summary reports monthly or quarterly. Wise managers might also conduct exit interviews every time an employee leaves the organization to find out what conditions cause them to turn their loyalty elsewhere.
Management is both an art and a science. Learning about management tools and mastering the skills of planning, organizing, implementing, and monitoring organizational performance can be a lifelong journey. While healthcare managers are looking for ways to continuously improve the healthcare organization, they should also look for ways to continuously improve their personal knowledge, skills, and attitudes for professional performance as a manager. Continuous performance improvement should be a virtuous cycle, leading to greater efficiency and effectiveness year by year for individual managers and for their organizations. Let's look at some common questions about implementing and monitoring. Policies and procedures don't seem to change anything. Why do we need them?
Policies and procedures are not designed for change. They are designed for consistency, and managers can use them to help their teams produce consistent results with minimal management oversight. Think of policies as a guide for decisions and procedures as a recipe for accomplishing tasks. Without clear policies, decisions can be slow in coming or more complex than they need to be. Without clear procedures, workers will accomplish tasks with a wide variety of consistency and quality.
How can I find the best key performance indicators?
Identify the measures that will be most important to the success of your healthcare organization. There may be measurements that are important to your regulators, or common indicators that all hospitals or clinics in your country rely on to monitor their performance. Ask yourself this question: if we experienced a critical failure that could put us out of business, what might it be, and how can we monitor it to prevent that failure? Answering that question can lead you to an appropriate list of key performance indicators.
Why do we have to constantly change the way we do things, even when they seem to be working well?
Change is constant, but it does not need to be considered an enemy. Changing expectations also represent new opportunities for improving service and reducing cost, enabling your healthcare organization to thrive. Continuous improvement can protect you from complacency and stimulate you for innovation. Maintain and affirm the parts of your operation that are performing well, but recognize at the same time that changing expectations can cause some processes to become obsolete. Managers need to constantly balance consistency with curiosity. They need to maintain effective systems with an eye for changes on the horizon. That concludes Module 9 of 15. In the next module, we will address the discipline of sustainability. Thank you for participating in the course on 4 essential disciplines.